It's a quiet evening, and you're sitting on the couch with your cat curled up beside you. You reach down to scratch behind their ears, and something makes you pause. You look a little closer at their eyes. Maybe one pupil looks bigger than the other. Maybe there's a cloudy film creeping across the surface. Maybe that third eyelid is halfway across the eye and just staying there. Your stomach drops a little. You tell yourself it's probably nothing. You tell yourself you'll keep an eye on it and see how things look in the morning. But what if I told you that for some of these changes, morning is already too late? What if I told you there is a very short list of eye symptoms that, according to veterinary ophthalmology specialists, can mean permanent blindness or even a life-threatening internal disease within 24 to 48 hours if they're ignored? Hi everyone, I'm Dr. Andrew Collins, your friendly neighborhood veterinarian. Cat eyes are strange and wonderful things. They're built to hunt in near darkness. They barely blink, and cats are absolute masters at hiding pain. That combination means an eye problem can go from mild to catastrophic in a single day. And your cat will never once cry out to tell you it hurts. Today, we are doing a full masterclass on feline eye emergencies. I'm going to show you exactly what a healthy cat eye should look like, the specific danger signs that mean you need to act right now, the mistakes owners make that quietly make things worse, and my exact emergency protocol for what to do in the next 10 minutes if you spot one of these red flags. Hit that subscribe button so you never miss something that could save your cat's sight. And let's get into it. Chapter 1. What a healthy cat eye actually looks like. Before we can talk about danger signs, we need a baseline. A healthy cat eye has a clear, glassy cornea, the clear dome on the front of the eye, with absolutely no cloudiness, no scratches, and no color change. The pupils should be equal in size and should react together, shrinking evenly in bright light and expanding evenly in the dark. The white part of the eye, called the sclera, should be, well, white, not red, not yellow. The third eyelid, that pale pink membrane that sits in the inner corner, should be tucked away and barely visible. And there should be no discharge beyond the occasional bit of normal, clear tearing. Here's the part most owners don't know. A cat's eyes are directly wired to their brain, their nervous system, and in many cases, their kidneys, their thyroid, and their blood pressure. The eye is often the very first place that a serious internal disease shows up, long before your cat seems sick anywhere else. That's exactly why this video matters. An eye symptom is rarely just an eye symptom. Now that you know what normal looks like, let's talk about what abnormal looks like, because this is the chapter that could save your cat's vision. Chapter 2. The 5 warning signs you cannot wait on. Warning sign number 1, unequal pupils. Take a look at your cat's pupils in even lighting. If one pupil is noticeably larger than the other, this is called anisocoria, and it is never something to simply monitor. Unequal pupils can signal a brain issue, a stroke, high blood pressure damaging the retina, or even certain cancers pressing on the nerves that control the eye. I have seen cats brought in for unequal pupils that turned out to have dangerously high blood pressure, secondary to kidney disease, and every single hour that blood pressure stayed elevated, more of the retina was silently dying. If you notice this, that's an emergency vet visit tonight, not tomorrow. Warning sign number 2, sudden cloudiness or a blue-white haze. If your cat's eye looks like someone breathed fog onto a piece of glass, that cloudiness could mean corneal ulcer, glaucoma, or uveitis, which is inflammation deep inside the eye. Glaucoma in particular is a ticking clock. It is a buildup of pressure inside the eyeball, and it can cause complete, permanent, irreversible blindness in as little as 24 hours if the pressure isn't brought down. A cloudy eye is not something you wait out over a long weekend. Warning sign number 3, a visibly bulging or protruding eye. If the eye itself looks like it's pushing forward out of the socket, this could be an abscess behind the eye, severe glaucoma, or trauma, and it requires immediate attention. A bulging eye can lose its blood supply entirely within hours. Warning sign number 4, the third eyelid staying up and covering part of the eye. That pale membrane in the corner is supposed to stay retracted. If it's creeping across the eye and staying there, especially in both eyes at once, this can indicate pain, dehydration, tetanus, or serious underlying illness affecting the whole body. Cats hide pain exceptionally well, so a raised third eyelid is often one of the only outward clues that something is deeply wrong. Warning sign number 5, thick yellow or green discharge combined with squinting. Clear, watery discharge can sometimes just be mild irritation, but thick, colored discharge paired with your cat holding the eye shut or pawing at their face usually means an infection or an ulcer that is actively getting worse. Left untreated, a corneal ulcer can perforate, meaning the eye itself ruptures. That is an emergency surgery situation, and it is completely preventable if caught early. If you are seeing any one of these 5 signs right now, pause this video and call an emergency vet. I promise you, the rest of this script will still be here when you get back. For everyone else, let's talk about why owners so often miss these signs or make them worse. Chapter 3. The mistakes owners make. Mistake number 1, the wait and see trap. Cats are prey animals at their core, and prey animals do not advertise weakness. A cat with a painful eye will often still eat, still purr, and still curl up in your lap like nothing is wrong. Owners see this normal behavior and think, well, they're clearly not in that much pain. Let's just watch it for a few days. Please stop doing this. The absence of crying or limping does not mean the absence of a real emergency. Some of the worst eye cases I have seen in practice came from owners who said they seemed fine otherwise, so we figured we had time. Mistake number 2, reaching for human eye drops. I understand the instinct. Your eyes hurt, you use Visine, so it seems logical to grab whatever is in your medicine cabinet for your cat. Please, never do this. Many human eye drops contain ingredients that are toxic to cats, and steroid-containing drops in particular can be catastrophic if your cat actually has a corneal ulcer. Steroids on an ulcerated eye can cause the cornea to melt and rupture within days. What looks like a harmless home remedy can turn a treatable problem into permanent blindness. Mistake number 3, assuming it's just allergies or dust. Cats can absolutely get mild irritation from dust, pollen, or scratch during play. But the assumption that every red or watery eye is minor is exactly how serious conditions get missed. The rule I give every one of my clients is simple. If it's only one eye, if there's any cloudiness, if the pupils look uneven, or if it's been more than 24 hours with no improvement, that is no longer a wait-and-see situation. Mistake number 4, forcing the eye open to look closer. I know the instinct is to pry the eyelids apart to get a good look, but if there's a chance of a corneal ulcer, applying pressure to the eyelids can push on the eyeball itself and risk rupturing an already thin, damaged cornea. Look at the eye gently from a distance. Take a clear photo if you can, and let your vet examine it properly with the right tools. Now that we know what not to do, let's talk about exactly what you should do. Chapter 4, the 10-minute emergency protocol. Step 1, do not touch or rub the eye. Even if your cat is pawing at it, gently redirect them with a soft cone or an old t-shirt collar if you have one, rather than physically restraining the paw against the face. Step 2, take a clear, well-lit photo of both eyes side by side. This single photo can be incredibly useful for a vet doing a phone triage, and it also gives you a baseline to compare against later if things progress quickly. Step 3, check both eyes for symmetry, compare pupil size, compare cloudiness, and compare how open each eye is. Write down what you see. Emergency vets will ask you exactly these details, and having them ready saves precious time. Step 4, do not apply any drops, ointments, or home remedies unless a veterinarian has specifically told you to use them for this exact situation. Saline rinse is generally the only thing considered safe to flush minor debris, and even that should be plain sterile saline, never tap water, and never anything containing alcohol or fragrance. Step 5. Call your vet or the nearest emergency animal hospital immediately and describe exactly what you're seeing. Use the specific words we covered today: unequal pupils, cloudiness, bulging, third eyelid elevation, discharge color. Specific language gets you triaged faster than a vague, "my cat's eye looks weird." Step 6. Keep your cat in a calm, dim room while you wait for guidance or prepare for transport. Bright light can worsen the pain of an inflamed or high-pressure eye, so a dim, quiet space helps keep your cat more comfortable during the drive. Chapter 5, when it's urgent versus when it's not. I want to leave you with a clear, simple filter you can use anytime you're unsure. If the issue is in one eye only, if there is any cloudiness or color change to the cornea, if the pupils are different sizes, if the eye looks like it's bulging, or if your cat is squinting hard and pawing at the face, treat it as urgent and call a vet today. If instead you're seeing a small amount of clear discharge in both eyes, your cat is behaving completely normally, eating, playing, and using the litter box as usual. It is reasonable to keep a close eye on it for a day, but even then, if nothing improves within 24 hours, get it checked. Cat eyes simply do not have room for guesswork. The tissue involved is delicate, the timeline for permanent damage is short, and the earlier a vet catches it, the more likely we are able to fully save the eye and your cat's vision. Your cat cannot tell you when something feels wrong, and their instinct to hide pain means the visible signs you do see are often the tip of the iceberg. That's exactly why noticing these small changes early and acting on them immediately is one of the most powerful things you can do as a pet parent. You are not being paranoid by taking a cloudy eye or an uneven pupil seriously. You are doing exactly what a good vet would want you to do. Has your cat ever had a sudden eye issue, and what did you do? Tell me your story in the comments below. I read every single one. If this video helped you feel more prepared to catch a problem early, please hit the like button and subscribe to the channel, and share this with another cat owner, because you might just help them save their cat's eyesight this week. I'm Dr. Andrew Collins. Thank you for loving your pets enough to protect them, and I'll see you in the next video.